Hi, I'm Dr. Jonathan Bispham. Now I'm creating this video so that you can understand how to read your reports and how to get the most out of your reports. And if you're like me, I tend not to look at instructions when I get something or when I buy something. With these reports, it will help you a lot. You'll get a lot more out of them if you understand the way they're laid out and how they've been calculated. So let's dive in. But before we do, let's just explain something. Now, a lot of the information that you will find in your report could be seen as prescriptive. It's as if we are prescribing that you should have certain vitamins, nutrients, or whatever it is. Now, it's not prescriptive. Everything needs to be taken in the context of your health. Now, we cannot tell what your health is like, okay? From the DNA test, we're getting results about where your genetic tendencies, your genetic predispositions lie. And that test, those results will be the same whether you're 1 day old or whether you're 101 years old. Now, your health will be different from day to day, month to month, year to year. And because we don't have access to any of your health information, we cannot prescribe. What we can do is we can say, if you have a tendency towards a certain condition or disease, that research has shown that a certain amount of, say, magnesium can reduce the risk. Now, from there, you need to evaluate, am I getting enough magnesium in my diet, or should I supplement? You may need to consult with a naturopath or your doctor, or may possibly need to have a blood test. So these results are going to show you where your tendencies lie, and that will highlight areas of life and your health that you need to focus on. Right, so without further ado, let's get stuck into the reports. Okay, well, there are two reports. The first report is called Your Genetic Results. This is the report that contains the specific details of everything that we test for. So if you're looking for specifics, this is where you'll find it. Now, after doing many of these reports, it was requested that we needed something that would allow people to understand how to action this a little bit better. Because they would look through the tests and wouldn't know which intervention to apply first, and maybe which intervention to apply next, and what was more important. So what we did is we created a system, in fact a computer program that did over 75,000 calculations just on your results. And what it does, it basically puts things in a hierarchy. And from that hierarchy, we can build something we call your Live Better Longer plan. And it will give you an idea of where to focus your efforts. Now, this should be seen as more of the summary report. The first one is the detail, and it's very accurate. The second one is the summary, and it's more general. Okay, but it will give you a much better idea of how to approach this on a day-to-day basis. So the first report we're going to look at is your genetic results. So let's have a look at that now. So here we have someone's results, and we're going straight down to the first test, Alzheimer's disease. And it's in alphabetical order, which is why Alzheimer's is first. And you'll see that the top part of the page is information about the test or the disease that we're testing. The middle section has this indicator, and it has a Your Results section. And the bottom part has a section with Your Action, and then it has this funny table underneath. Let's go through all of those, okay? So the Your Results section, okay? Now these are actually your specific results, and with this lady and in her test, it says the average lifetime risk of Alzheimer's disease for a female is approximately 17%. Your results show you have the E3/E3 APOE variant pair, which gives you a lower genetic risk of Alzheimer's disease compared to the global average. Now, at this point, let's just reiterate that genetic risk is only part of the whole story. Okay, and that's why we have this test. We're just looking at one part, the genetic risk. We're going to talk about the lifestyle risks and how you can change your lifestyle to upregulate or downregulate genes so that you reduce that genetic component and you reduce your overall risk of the disease. So the genetic risk is just part of it. Now on the right hand side of this middle section you'll see this indicator, and it looks a bit like a fuel gauge. We have a green section, yellow section and a red section. Now the yellow section, if the needle is in the middle of the yellow section, this is the global average. With this test, with these genetic variations, this is where the global average would come. Okay, so if you're in the yellow, you could assume that you are within the global average, and because the average risk of Alzheimer's disease for a female in this case is 17%, you could make the assumption that you're around about 17% lifetime risk of Alzheimer's disease. Okay. Now, if you're in the green, you could make the assumption that you are lower than 17%, but we cannot give you a specific percentage because there are a lot of factors to take into consideration and research is not there yet. If you're in the red, you can assume that you have a higher risk than the 17% global average, but again, we cannot tell whether that's 18%, 19% or 30%. Now, obviously, the higher you are in the red, then the higher the risk. Okay. Now, the reason, as you'll see when we go through the report, the size of the green and the red will be different, and that depends entirely on what range your best genetic variations will show and your worst genetic variations. Okay, so if there are 10 different genes we're testing, the range might look different to this one where we're only really testing one gene. Below that section, we have your action. Now in this case, because this lady is in the green and she has a lower risk than average, there is no specific action given for this test. We'll come across a test in a moment where there will be an action given, and you can see what that looks like. Underneath that we have this table, and this table shows the genes that are tested, in this case the alipoprotein, so it's APOE is the code for that. The polymorphism is the code given to the variation that we're looking for, and then we have the genotype, which is the variation of that gene that have been inherited from the mother and from the father. Unfortunately, we cannot tell which is mother and which is father, but both here they've got the TT version, so the T from the mother and the T from the father, and the test below it's the CC. Okay, and the last section is the frequency. So this is the global frequency of somebody having that version. Okay, and that is Alzheimer's disease. Okay, now moving on. Now we're going to look at another test result for diabetes type 2, adult onset diabetes. And the first thing I want to draw your attention to, if we have a look at this now, is that the test results show that this person is in the yellow. So they're pretty similar to the global average genetic risk of diabetes type 2. But they've got an action plan, whereas the other one didn't have an action plan. And sometimes you could be in the yellow in the global average and have an action plan, and sometimes not. Now the reason for that is it all depends on the how likely you are, the incidence of that particular disorder or disease. So if we look at diabetes type 2, and this is a test result for a female, and the risk, lifetime risk of diabetes type 2 is approximately 20%, which is fairly high. That's 1 in 5. So even though this person is in the yellow, because that gives them that they've still got a 1 in 5 times risk of getting diabetes type 2, we have put the intervention plan in. Okay, because this report is all about prevention. Now the next thing I want to draw your attention to is the most common mistake that people make when they are reading these reports. Generally what happens is as soon as you get the reports, you download them and you scroll through looking for where you're in the red. And that's completely the wrong way to look at these reports, and I'm going to show you why that is. Okay, so let's again look at this one, diabetes type 2, and with this one, diabetes type 2, in the yellow, the global average risk is 20%, so we can make an assumption that this person has a roughly 20% risk, the same as most other women in her life. If we then scroll on to the next test, glaucoma, we see that glaucoma, the needle is well and truly in the red. Okay, now the global risk, the average incidence for a female of glaucoma is 5%, much less than diabetes. And the needle here is in the red. If it were in the yellow, it would be 5%. It's in the red. That could be 7%, it could be 6%, it could be 10%. Okay, but it's still less than the diabetes was at 20%. And the diabetes indicator was in the yellow. So when I look at that, I think, well, it's more important for me to focus on prevention in relation to diabetes than it is glaucoma, because I have a higher risk of getting diabetes than I do of getting glaucoma. So whether the needle is in the red, the yellow, or the green has to be taken in the context of the disorder you're looking at and the incidence of that particular disorder. Okay, so we've covered your genetic results, and now we're moving on to the Live Better Longer program. And as I said before, the Live Better Longer program it's like a summary of all your results, all put together with over 75,000 calculations to order it into some kind of plan that you can actually use on a day-to-day basis. So let's dive in now and have a look at that. So if we scroll down past the disclaimer, we'll get to this area, which is actually the Live Better Longer program, where you have the different weeks organised with various different interventions. Now, when we talk about interventions, there are some examples here. You can see get regular exercise, and there's some information about regular exercise. Then we have maintain healthy folate levels, maintain healthy vitamin A levels, and get adequate omega-3 fats. So what has happened here to put those interventions right up the top of your plan? Well, what's happened is that the program has gone, the computer has gone through all your results, the diseases and the various risks of the normal incidence of those diseases, and it's calculated where your highest risks are. It's then looked at all the possible interventions that will reduce your risk of those diseases. Now, the very fact that get regular exercise is right at the top of the report suggests that this person probably has a number of disorders that they're at risk of that have been scientifically proven to be prevented or the risk lowered from regular exercise. And that will be why this is at the top. If we move down to week 2, maintain healthy folate levels, and folate is vitamin B9, and from this we can assume exactly the same. There are various disorders where this person, if they were to have healthy folate levels, that would reduce their risk of disorder, and probably more so than vitamin C or vitamin E, which is why it's come up higher in their test. They've probably got an issue with a gene called MTHFR, and they can't process folate well, which is why this is so high. So what it's doing is it's putting things in an order. Now, because of that, and the order is a hierarchy from highest down to lowest. Now, because of that, you don't have to use this as a week-by-week process. Okay, you can just implement the highest things on the list. And then once you've got that under control, or if you've already in your life got that under control, then you can move on to the next one and make sure you have that area under control, then move on to the next one. And you can do it in whatever time frame you want. I mean, you could do this in your 13 weeks, you could do it in 13 months. It makes absolutely no difference. But the things that are on week 1, week 2, and week 3 are much more important than the things that are on week 13, 14, and 15. But even the things that are on, it's only 13 weeks, so it's only going to go down to 13. But the things that are on week 13 are still very important, because out of all the possible interventions, there may be 60 to 100 interventions. And within that 13 weeks, you're probably going to see about 20, 25 of them, not even half. So intervention 60 may not be important, but intervention 20 in week 13 is still relatively important. So this whole 13 weeks is going to make an enormous difference if you get this in order. Now, the other thing you'll notice is that week 1, there is one intervention, get regular exercise. How come on week 2 there are 3 interventions? Well, it's just relating to the amount of time it takes to get these things organised. Okay, so organising a regular exercise program may be a lot more involved than just changing your diet slightly and buying a few different things at the supermarket. So sometimes you'll see 2, 3, 4 things in a week, and other times you'll only see 1. In fact, if we scroll down, you'll see week 3 is follow a low carbohydrate diet. Now that may take a fair bit of organising in order to do that, which is why it's the only thing. Week 4, don't smoke. Again, that may take a fair bit of organising, starting a no smoking program or a hypnosis program. That's why there's only one thing, so you just focus on the one thing. If you don't smoke in this situation, then week 4 is already done. You just move on to the next week. So the idea here is you do the intervention from 1 week, say week 1, which in this case is get regular exercise. And so you're walking and you're swimming and you're going to the gym. And then in week 2, you add on the next intervention without stopping the first intervention. In week 3, you're doing all the interventions from week 1, week 2, and starting to add week 3 in again on top of that. Okay, so you keep adding on, adding on, adding on. So that is the Live Better Longer program. That's how to get the best out of that. Now, the last thing we're going to come to on the Live Better Longer program report is the diet plan. Now, the diet plan is a way to integrate all the information that was in the first report, the genetic health report, into something that's a much more simple to implement on a day-to-day basis as far as your diet goes. Okay, so what we've done here is we've taken 150 fairly common foods from the Australian Food Standards database, and we've got all the information about the carbohydrate content, the protein, the fat, the vitamin content, the calories, the glycemic index, information in some cases about how inflammatory or anti-inflammatory that food is. From there, those calculations have been thrown into the mix, and we have come out with the foods that are most likely to be most beneficial across the board to you. And again, we've done a hierarchy from the foods that are most likely to benefit you all the way down to the foods that are least likely to benefit you. And to make this really easy, we've also split it into columns. So let's have a look at that now. So we see the diet nutrition guide here, and you'll see the first column is vegetables. The second column is carbohydrates. The third is protein. The fourth is fats and oils. Then we have fruit, and then we have beverages. Now, on the left-hand side, you'll see eat mostly, and then below that, you'll see a section that says eat some, and a section that says avoid. Okay, so if we look at vegetables here, we can see that this person, kale, spinach, and Brussels sprouts are very high on the list. Okay, so they'll be vegetables that have the nutrients, the fiber, and I'm guessing from those vegetables they have something called sulforaphane, which is an amazing anti-cancer and anti-inflammatory component. So I'm guessing that this person does have some genetic predisposition, possibly to cancer or a degenerative disease that will be reduced by reducing inflammation. So the way you can use this is even in one section like eat mostly, the foods at the top of the list are likely to be more beneficial than the foods at the bottom of that section. And the same all the way down. Okay. Now with the vegetables with this person, there are none in the avoid section. If we come to carbohydrate, you'll see that there are some there are some carbohydrates at the top. There's not many in the eat mostly, and I'm guessing this is because this lady has. Well, in fact, we saw from the Live Better Longer program earlier on, it said low carb diet in the fourth intervention. So that's probably why there's not many carbs there. There's a few and eat some, but there's lots in avoid. Okay. Now, if they're in avoid, it doesn't mean you have to completely avoid things. You know, it just means be sensible about this. Reduce those foods. Make some better choices when you're deciding what to eat. And so that's pretty much the diet and nutrition guide all the way through. Now, sometimes there are foods in there that they're not health foods. You know, there's beer and there's wine and there's all sorts. Okay, they have nutrient qualities to them. There are also energy drinks, and sometimes energy drinks, which are not part of a normal healthy diet, actually come up in the eat some area, and that's because they are fortified with a lot of vitamins and minerals. So when they're tested, they're found to contain a number of effectively supplements dissolved in them. And if your report shows you need those supplements, those drinks may come higher up. If your report shows that you don't handle caffeine, it will come lower down. Okay, that's how you use the diet and nutrition guide. So now you are ready to get your reports, and hopefully you'll get straight into them and find all sorts of interesting information that's going to help you live longer and live better. Bye for now.